Hey guys, Swen Sandberg, physical therapist with YADAYADA, and today I'd like to speak with you about mechanical low back pain. 1, how to understand it, 2, how to assess it, and 3, hopefully how to treat it. So of course, the first thing we got to do is, what is mechanical low back pain? The majority of back pain is mechanical, meaning that it's caused by moving parts. And movement can lead to pain, or adopted postures can lead to pain. And of course, if you already have pain, this can make your pain worse. Oftentimes I have my patients tell me that with mechanical low back pain, they hurt more with repetitive bending, or if they sit for too long. Other patients tell me that sometimes going from a seated position to a standing position can be painful, or that they get stuck halfway up, and that it takes a minute to kind of unratchet or to stand back up straight. This is all mechanical pain. A really good example of mechanical pain is this. And you can do this with me. If you take your finger and you pull it back like this, well, that hurts, right? If I let it up, well, the pain is almost gone immediately. Now let's say I take my finger and I hold it back there for 2-3 hours. Well, clearly that's going to really hurt. And it may take some time for that pain to go away once I start moving it back into its resting position. This is mechanical pain. Your back goes through the same thing. That's why these patients complain of bending, sitting too long, right? Those moving parts become irritated. Conversely, I have the same patients tell me that, hey, if I move around, or if I change position frequently, if I go for a walk, my pain gets better. Again, this is mechanical. This is mechanical pain. This is how it works. And if this sounds familiar to you, it's likely that there's a few simple movements that you can be taught or that you can learn yourself that will vastly improve your mechanical low back pain. So to determine what these movements are, we first have to understand how to read your pain. And so what I'd like to do is help you learn to read your pain. There's 2 terms that we want to use at this point. The first term is peripheralization, and the second term is centralization. And once you figure these 2 things out, then figuring out how to help your low back pain is easy, okay? In order to do that, I've asked Chelsea to come and help me demonstrate what peripheralization and centralization is. All right, guys, now that we've got Chelsea here, she's going to help us learn more about peripheralization and centralization. Again, guys, once you've got this down, it's so easy to figure out what you need to do for your low back pain. So in this example, let's say Chelsea has left low back pain and buttock pain, okay? Now, I'm going to ask Chelsea to bend forward 5 times. So Chelsea, if you'll just bend down, touch the floor, and come back up. 1, 2, 3, 4, and 5. Good. And let's say now that Chelsea has finished that movement, her symptoms have now moved down to her thigh and calf. This is peripheralization, meaning it moved farther away from the back and down the leg, okay? Peripheralization can also happen just within the back. Let's say she started bending forward and her symptoms were close to the spine, and then they peripheralized or moved away from the spine, okay? So we consider this a negative response. This is not the movement of choice for Chelsea, okay? So Chelsea, now I'm going to have you put your hands on your back. Good. Now if you'll bend backwards over your hands, good. And why don't you go ahead and do 4 more of those? Good. I think that was 3, right? And 4. Good. You can go ahead and move your hands. Now let's say with this movement, her symptoms now came out of the calf, came out of the thigh, disappeared from the buttocks, and now we're just in her left back. This is centralization, okay? This is what we're looking for. This is a positive response. So now what we can do is we can say Chelsea has a directional preference, and that's the term they use in the literature, for back bending movements. So Chelsea, move back just a little bit. Good. So our goal now is to build movements and exercises that bend her backwards to get these symptoms to stay centralized and then eventually disappear, okay? Okay, guys, so sometimes we won't see centralization or peripheralization in standing. And sometimes you'll have to unload or lie down and repeat similar movements to recognize or to feel that peripheralization and centralization. So I'm going to have Chelsea demonstrate some of those positions that you may have to assume to further test out your mechanical low back pain, okay? So the first thing I'm going to have Chelsea do is bring her knees up to her chest, and then go ahead and just give them a pull, Chelsea, and then bring your feet right back down to the table. Now, she would repeat this up to 20 times, again, the whole time paying attention to her symptoms, whether they're moving away from the spine, becoming less intense. That would be peripheralization. Again, negative. But let's say she's in this position, her symptoms go away, or they get really close to the spine again. This would be centralization, as talked about before, and this would be a positive sign. So you may have to lay down or unload your spine to appreciate peripheralization and centralization. Something else that you might have to do is lay on your stomach. So Chelsea, if you'll roll over. So Chelsea's going to perform what we call a press up, or in yoga, it's an up dog. So go ahead and press up, Chelsea. And then go ahead and just let everything sag when you get to the top. So go ahead and do that again for me. And then exhale and just let this relax. Good. And then back down. So these are two positions that you may have to try to assess that mechanical low back pain for peripheralization or centralization. Okay? Okay, guys, so to summarize, we know that we're doing the right movements if the pain is getting closer to the spine and lessening. Pain should gradually decrease if you are on the right track. The other thing that you should see is improved movement, meaning Chelsea should be able to go back farther if she's doing the right exercise. So let's say Chelsea started and she could only go this far. If it's the right exercise, afterwards she should be able to go way back here like she can right now. You know you're doing the wrong movements or exercises if your pain is worsening or is unchanged, if your symptoms are moving away from the spine and down the legs, or just moving away from the spine if you only have back pain. Also, you'll know you're on the wrong track if your motion is worsening. So again, if Chelsea can bend backward this far, and then she does a bunch of repeated back bends, and all of a sudden she can only move this far, that's a problem. And so those are the ways you know you're on the right track or the wrong track. So what I'd like to do right now is have you guys go through a little assessment now that you know what centralization and peripheralization is, and let's figure out what your directional preference is, and then you can link over to my other videos based on what you find out and get some exercises that hopefully help reduce your pain. So go ahead and stand up and let's go through this together. So Chelsea, I'm going to first have you bend forward 10 times. Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And sometimes it'll take more repetitions, like 20 or 30. So don't hesitate to plow on through and do more repetitions if you're not noticing a change. So in the earlier example, Chelsea did not prefer bending forward. So again, in this example, we're going to say that her symptoms, again, move down to the thigh and calf. This would be a negative response, and we would not want to pursue this type of exercise or stretching. Now, Chelsea, if you put your hands on your back again, and you'll bend backwards 10 times. And again, do this with us. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Now, because this is Chelsea's directional preference, her symptoms moved back to her spine and hopefully lessened, okay? Now, as always, if you're getting peripheralization, stop. If you're getting centralization, continue with that activity. Most people are going to respond to back-bending activities like Chelsea in this example. Very few people are going to respond to flexion-based activities. That being because most of us spend our day flexing, and that is painful for a lot of us after a long time or a lot of repetition. So be careful. Some people will initially feel better with bending forward, and then 20 minutes will feel a lot worse. So just kind of watch for that. Again, about 80% of people are going to respond to back bending. So once you've assessed this and you've figured out what the right movement is for you, then again, head over to my other videos for extension exercises if you're a back bending responder like Chelsea was, or flexion exercises if you happen to be a flexion responder. And as always, if your symptoms get worse, if you begin to have symptoms of pain, severe pain, weakness, or numbness down your leg that is unrelenting, you definitely want to seek out medical attention from a qualified medical practitioner. Thanks.